Good morning, this is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to talk to you some about the second molar extraction cases. For a good while, people tried not to extract any bicuspids or any teeth in the front of the mouth, and they'd go through the whole case, and then they'd pull out the second molars back at the back, and a lot of them would get them lined up good. Simply by extracting the second molars rather than taking out bicuspids. This was just a kind of a fad, and then people got around it. And I did a case one time, quite a ways back there, on a second molar extraction. And let's show you that case and show you how you can avoid what they were worried about there. Now, let me get this deal going here. Okay, here's a young lady, nice profile, everything is lined up good in here, and we're going in here and we'll take her second molars out, and I'll show you what you just do to keep from dishing the person in, or you don't want to bring the lips out too far on someone like that. So you can take second molars and not have any big problem with it at all. So let's kind of look at this again, and I'm going to erase that. And now here she is as an older young lady. And we've got a beautiful facial profile with her, and this is a smiling profile. The mention in here is a little more. She's got her teeth apart right here, but here the teeth are together, and the profile's still just a little bit on the upper side, but a nice looking young lady, and it worked out good in her particular case. And this is when she was a teenager or early teenager. This is after she got older. And you can see we've got a slightly dished in this slight face, which is fine, and it really looks good on her. So I appreciate doing second molars. You can take anybody and extract their second molars if you were careful and not bring the teeth back again. You could take the wisdom teeth and go up into this space. Let's take a look at her wisdom teeth in here. We had this young lady in, I think it is age 6 here. This is pretty young. I think that must be a mistake in there. And anyway, this is 1972, and in this particular case, we've got bicuspids up here. The cuspid is crowded in the bis, and you're trying to stick all this in. You get the lateral come back to here, and you've got this much room to try to put these 3 teeth in. There's going to be a kind of a crowded situation. Well, let's look at it a little further down the line. This is 42. Now here's age 8, and she's got the upper 4 and lower 4 anterior teeth in place. The cuspids are coming in, but we've got a problem getting these in this gap right here, and these teeth on the bottom arch. You see the cuspid will go in here. This is a lateral, by the way. This is a panorex that's, you just held them in place, let them bite together. So these teeth need to fit in this gap. So in this case, she is 8 years old, and her wisdom teeth haven't formed at this point. Now we'll go here. All right, this is age 10. And the last deciduous tooth is here. These 2 deciduous teeth right here. And we've got just about space enough really to get the teeth in, but a little short of space in this area here. Time to put this bicuspid up in here, you might could squeeze that one in that area. So it's a little bit on the crowded side, but not bad, and I could have expanded the teeth and got it in or taken the wisdom teeth out. But in this case, we decided to take the second molars just to show people and we've got 4 good wisdom teeth there that we want to keep. So we got her back at age 11, 5, just about 12 years of age, and we decided to take these second molars. So we took the second molars, and we have 4 wisdom teeth left. Now this is going to allow us to expand this a little bit and line these teeth up really good in this area, but we could have done it without doing this, but it had to extract the wisdom teeth. So let's go ahead and see what we did on this. I'm going to go to the next Panorex, which is age, this is 4, this is 5. Now this is taken when she was age 13 and 2, and we took out her second molars and got all these teeth lined up in here real good. The wisdom teeth are coming back here. So we're going to get these wisdom teeth to come on up into this position, and we'll take this. This was age 13. We took that Panorex, number 5. Now here it is, number 6. And she is age 15 at this time. And we've taken her out of her braces. Everything's off, everything's lined up, and we've got the wisdom teeth that drifted up to here. And we'll just follow this case on to the wisdom teeth all come in the mouth, everything. So here it is, age 17, 2. And we got the wisdom teeth up here and set them up. This will come on down in there, right there. That's the 7th Panorex we've taken on her, and she's age almost 18 years old. And so we'll have to watch. We have her in the retainer here, and we're going to have the wait further along down the way. This is age 25, and now these are wisdom teeth right here, and they're fitting in there, so we took out the second molars, and the case worked out like that. So we took a long time taking the second molars out, and we had to come back and put something to get the wisdom teeth came in here, in her case, without any problem. And she is 25 years of age now and got just a perfect set of teeth. And so you can go through and do this, but I don't anticipate that you could have gone in earlier in her life and taken out some bicuspids. I think in here, taking the second bias maybe. You take the second bias, you dish the anterior end very little, and then move the wisdom teeth and all up into this area, and still had the case straightened out in good shape. So this is a odd way to do it, but you can do it this way. You can straighten the teeth out, and you can take different teeth. But it's pretty obvious that there are many people who need extractions and those that don't. And you can see how much she's going to grow, and you can make a decision down the line on that. But this case ended up almost perfect by extracting the second molars and doing this. So So here this is age 15, 6, and here we are, age 25. We've got a good overbite, everything just almost a perfect set of teeth for her. And there's her teeth. 1990 is a beautiful set of teeth. And so doing second molars is not a necessity. You can come in and take out the second bias, and you needed a little additional room, and you can get a little bit up here without dishing the face in too much. So we very rarely took second molars, and that's almost as good as you go to get with orthodontic right there. And then down on the bottom they're staying good, and she's 25 years of age, and I hope that you pick up something from this if you were hooked into that second molar extraction group that used to take them all out, take a lot out with the second molar. You don't need to, but if you do, this is a second molar and it's working fine. And so thank you for watching, and I'm going to try on these last videos of my career to cover things that I think are of interest and not try to put out little bitty short videos that attract a lot of people that's thumbing through, like going through the Sears Roebuck catalog. Here, you just flip through. If you're interested in really learning orthodontics, I want to help you. And this stuff is going, it's unusual all over the world. And we don't like too many having 600 videos. You can learn darn near anything you want to in orthodontics off these videos. And thank you for watching. And I'm going to close out now, and we'll finish this case up. Thanks again.